Hello and welcome to Maine General's Introduction to COVID-19. This training was created to help all staff navigate COVID-19 in our organization. My name is Tara Vesna and I am the Licensing and Accreditation Specialist here at Maine General. I will be guiding you through this training today. So what is COVID-19? COVID-19 is a novel coronavirus that has been declared a pandemic by the World Health Organization in a civil state of emergency by Governor Mills. The Maine CDC has provided guidance regarding the health and welfare of our community. This disease, caused by SARS-CoV-2, can affect the upper and lower respiratory tract. Those exposed have experienced a large range of symptoms, and we will discuss the symptoms on the next slide. These symptoms may begin to show up to 2 to 14 days after exposure to the virus. Please remember that information regarding this virus is changing at a very fast rate, and you should always verify your information with the federal and state CDC at cdc.gov. Please know the symptoms of COVID-19, which can include the following: cough, fever, chills, muscle pain, shortness of breath or difficulty breathing, sore throat, or new loss of taste or smell. Please seek medical care immediately if someone has these emergency warnings of COVID-19, and those are trouble breathing, inability to wake or stay awake, persistent pain or pressure in the chest, new confusion, or bluish lips or face. Please remember that this is not a list of all possible symptoms, and additional references can be found on the CDC website at cdc.gov. According to the CDC, COVID-19 most commonly spreads through close contact from person to person. Exposure by respiratory droplets produced from coughing, sneezing, singing, talking, and even breathing are the main cause of infection when they are inhaled or come in contact with mucous membranes, or the lining of the nose and mouth. Spread from touching contaminated surfaces is not thought to be a common way that COVID-19 spreads. A person could theoretically get COVID-19 by touching an object or a surface that has the virus on it and then touching their own mouth, nose, or eyes, but it is uncommon. People who are physically near or within 6 feet of a person with COVID-19 or have direct contact with that person are at the greatest risk of infection. Remember these 10 ways to protect yourself from infection. Perform hand hygiene regularly and carefully. Avoid touching your face skin mask. Wear PPE, mask, eye protection, and gloves when necessary. Read the Friday Report weekly. Avoid touching, shaking hands, and hugging people. Physical distance when able, and that's in the elevators, the break rooms, offices, and etc. Avoid crowded places like sporting events. Monitor yourself for symptoms daily. Sneeze and cough into tissues, and dispose of used tissues quickly. Additional resources can be found on the CDC website. This slide outlines what PPE you should be wearing based on your role. If you're working alone in an office, you may remove your face covering, but you must reapply it if someone enters your area. If you're working with others in a non-patient setting, you must always wear your face covering. If you're having direct interactions with patients, you must always wear your procedure or surgical mask and eye protection when the community transmission of COVID is in the moderate or severe category. If you're providing direct patient care to possible and confirmed COVID patients, you must wear an N95 respirator or equivalent and eye protection. Additionally, please be conscious of the added risk from removing your face covering while eating in a break area and physical distance when feasible. Please check with your supervisor if you have any questions regarding what PPE you should be wearing. To maintain a safe workplace, you must use the Health Check screening tool before work each day. The first time you use the tool, you must enroll either by texting or using a computer. Complete the survey questions about exposure and symptoms. You will then be cleared with a green or yellow badge or not cleared for work. Follow the instructions on your screen. If you are green, you will report to work and show or forward your badge as instructed by your supervisor. If you're yellow, you will report to work and follow special precautions given to you. Show or forward your badge as instructed by your supervisor. If you are not cleared, you cannot come to work and must contact your supervisor and backtowork@mainegeneral.org. Maine General has a culture of safety and well-being for both our patients and employees. Our organization is part of a COVID-19 vaccine rollout plan in the partnership with the state of Maine. To comply with our COVID-19 vaccination policy, you need to complete the COVID-19 vaccination survey in Ready Set and do one of the following. Get a COVID-19 vaccination offered through Maine General. Get a COVID-19 vaccination elsewhere and provide documentation by faxing to 207-248-0401. Or, if you do not want the COVID vaccine, choose I do not want the COVID vaccine via the Ready Set survey. Speak with your supervisor if you have questions about the COVID-19 vaccinations at Maine General. If you receive the vaccination or submit a declination, you will still be required to wear a mask from the moment you enter a MGH facility until you leave. Thank you for taking the time to listen to this presentation. Please see the below resources and direct any questions to the appropriate party based on the topic.